Alright guys, so this video is touching on osteoporosis and arthritis. So to start off, osteoporosis is when bone tissue becomes porous and brittle due to loss of mass. So remodeling is imbalanced and bone respiration exceeds formation, and this leads to an increased risk of fractures. Coming from osteoporosis, we have osteopenia, which is bone mineral density lower than normal, but it's not as bad as osteoporosis. And osteoporosis is just more severe. The mineral density is much lower, and you're at higher risk for a fracture. Some of the causes of osteoporosis are aging, hormonal changes, mainly postmenopause, nutritional deficiency, and lack of resistance training, as well as some certain medications that you might be on. Moving over to arthritis. Arthritis is inflammation of one or more joints. This may involve osteoarthritis, which is a degenerative joint disease. This can involve rheumatoid arthritis, which is chronic, systematic, inflammatory autoimmune disease. So it's local inflammation responses causing inflammation in joint lining, bony erosions, muscle loss, all over the body. And the third one is fibromyalgia. This is a rheumatologic syndrome. It's chronic widespread pain in muscle, ligaments, and joints. And you have certain points where you're very tender at on your body. Some of the risk factors for this is age, family history, obesity, and past injuries. Treatments to arthritis can be anti-inflammatory pain relief, so pain medicines, physical therapy, lifestyle changes, and worst case scenario, surgery. Some things you can do to prevent osteoporosis and arthritis are, first, on the osteoporosis side, eating a balanced diet, resistance training, and avoiding smoking and alcohol. Some of the things you can do to prevent arthritis are to improve your bone mass, which would ultimately improve your bone health. You can do this implementing this exercise program, so cardiovascular exercise 3 to 5 days a week, 150 minutes at moderate intensity, 75 minutes at vigorous intensity. Make sure this is low joint stretches. So if you have if you have arthritis in your knee and it's very bad, then you want to, let's say, avoid walking on the treadmill because that might put some strain on that. Resistance training 2 to 3 days a week at 60 to 80% of your 1 repetition max. Working 1 to 3 sets and 8 to 12 reps. Body weight is most important because, again, like if you have arthritis in your knees and you want to add a lot of weight to your